Hey Alpha Nurses, I'm Nurse Sandra from alphanurseguide.com. This is NCLEX PN Review Lesson 18. We're going to be doing medical surgical questions. This is part 2. I'll link part 1 in the description. You can follow me on Facebook, Instagram, and TikTok to get any updates. Links will be in the description. Without the way, let's get started.
Question 1. The nurse is reading the healthcare provider's progress notes in the client's record and sees that the HCP has documented insensible fluid loss of approximately 800 ml daily. Which client is at risk for this loss? A client with a Jackson Pratt drain. B. A client with a urinary catheter. C. A client with a fast respiratory rate. D. A client with a nasogastric tube set to low suction. The correct answer is C. A client with a fast respiratory rate. Rationale: sensible losses are those that the person is aware of, such as those that occur through wound drainage, GI tract losses, and urination. Insensible losses may occur without the person's awareness. Insensible losses occur daily through the skin and the lungs. Question 2. The nurse is reviewing the health records of assigned clients. The nurse should plan care, knowing that which client is at the least likely risk for the development of third spacing. A. The client with sepsis. B. The client with cirrhosis. C. The client with kidney failure. D. The client with diabetes mellitus. The correct answer is D. The client with diabetes mellitus. Rationale: fluid that shifts into the interstitial spaces and remains there is referred to as third space fluid. Common sites for third spacing include the abdomen, pleural cavity, peritoneal cavity, and pericardial sac. Third space fluid is physiologically useless because it does not circulate to provide nutrients for the cells. Risk factors include liver or kidney disease, major trauma, burns, sepsis, wound healing, major surgery, malignancy, malabsorption syndrome, malnutrition, alcoholism, and older age. Question 3. The nurse is reviewing the health records of assigned clients. The nurse should plan care knowing that which client is at risk for fluid volume deficit. A. The client with cirrhosis. B. The client with a colostomy. C. The client with heart failure. D. The client with decreased kidney function. The correct answer is B. The client with a colostomy. Rationale: causes of a fluid volume deficit include vomiting, diarrhea, conditions that cause increased respirations, or increased urinary output, insufficient intravenous fluid replacement, draining fistulas, ileostomy, and colostomy. A client with cirrhosis, heart failure, or decreased kidney function is at risk for fluid volume excess. Question 4. The nurse is caring for a client who has been taking diuretics on a long-term basis. Which findings should the nurse expect to note as a result of this long-term use? A. Gurgling respirations. B. Increased blood pressure. C. Decreased hematocrit level. D. Increased specific gravity of the urine. The correct answer is D. Increased specific gravity of the urine. Rationale: clients taking diuretics on a long-term basis are at risk for fluid volume deficit. Findings of fluid volume deficit include increased respirations and heart rate, decreased central venous pressure, weight loss, poor skin turgor, dry mucous membranes, decreased urine volume, increased specific gravity of the urine, dark-colored and odorous urine, an increased hematocrit level, and an altered level of consciousness. Gurgling respirations, increased blood pressure, and decreased hematocrit as a result of hemodilution are seen in a client with fluid volume excess. Question 5. The nurse reviews electrolyte values and notes a sodium level of 130 milliequivalents per liter. The nurse expects that this sodium level would be noted in a client with which condition? A. The client with watery diarrhea. B. The client with diabetes insipidus. C. The client with an inadequate daily water intake. D. The client with the syndrome of inappropriate secretion of antidiuretic hormone. The correct answer is D, the client with the syndrome of inappropriate secretion of antidiuretic hormone. Rationale: hyponatremia is a serum sodium level less than 135 milliequivalents per liter. Hyponatremia can occur secondary to syndrome of inappropriate antidiuretic hormone secretion. The client with an inadequate daily water intake, watery diarrhea, or diabetes insipidus is at risk for hypernatremia. Question 6. The nurse is caring for a client with leukemia and notes that the client has poor skin turgor and flat neck and hand veins. The nurse suspects hyponatremia. Which additional signs/symptoms should the nurse expect to note in this client if hyponatremia is present? A. Intense thirst. B. Slow bounding pulse. C. Dry mucous membranes. D. Postural blood pressure changes. The correct answer is D. Postural blood pressure changes. Rationale: postural blood pressure changes occur in the client with hyponatremia. Intense thirst and dry mucous membranes are seen in clients with hypernatremia. A slow, bounding pulse is not indicative of hyponatremia. In a client with hyponatremia, a rapid, thready pulse is noted. Question 7. The nurse is caring for a client with a diagnosis of hyperparathyroidism. Laboratory studies are performed, and the serum calcium level is 12.0 mg per deciliter. Based on this laboratory value, the nurse should take which action? A. Document the value in the client's record. B. Inform the doctor of the laboratory value. C. Place the laboratory result form in the client's record. D. Reassure the client that the laboratory result is normal. The correct answer is B. Inform the doctor of the laboratory value. Rationale: the normal serum calcium level ranges from 8.6 to 10.0 mg per deciliter. The client is experiencing hypercalcemia, and the nurse would inform the doctor of the laboratory value. Because the client is experiencing hypercalcemia, the remaining options are incorrect actions. Question 8. The nurse reviews the client's serum calcium level and notes that the level is 8.0 mg per deciliter. The nurse understands which condition causes this serum calcium level. A. Prolonged bed rest. B. Adrenal insufficiency. C. Hyperparathyroidism. D. Excessive ingestion of vitamin D. The correct answer is A. Prolonged bed rest. Rationale: the normal serum calcium level is 8.6 to 10.0 mg per deciliter. A client with a serum calcium level of 8.0 mg per deciliter is experiencing hypocalcemia. The excessive ingestion of vitamin D, adrenal insufficiency, and hyperparathyroidism are causative factors associated with hypercalcemia. Although immobilization can initially cause hypercalcemia, the long-term effect of prolonged bed rest is hypocalcemia. Question 9. The nurse is caring for a client with a suspected diagnosis of hypercalcemia. Which sign/symptom is an indication of this electrolyte imbalance? A. Twitching. B. Positive Trousseau's sign. C. Hyperactive bowel sounds. D. Generalized muscle weakness. The correct answer is D. Generalized muscle weakness. Rationale: generalized muscle weakness is seen in clients with hypercalcemia. Twitching, positive Trousseau's sign, and hyperactive bowel sounds are signs of hypocalcemia. Question 10. The nurse is instructing a client on how to decrease the intake of calcium in the diet. The nurse should tell the client that which food item is least likely to contain calcium. A. Milk. B. Butter. C. Spinach. D. Collard greens. The correct answer is B. Butter. Rationale: butter comes from milk fat and does not contain significant amounts of calcium. Milk, spinach, and collard greens are calcium-containing foods and should be avoided by the client on a calcium-restricted diet.
That's all I have for this video. Please like, share, let me know if you have any questions. If not, I'll see you in the next video. Thanks for watching.